Good afternoon. Today is June the 25th, 2020, and we are doing our updates as it relates to COVID-19. Also joining us today is going to be Kelly Colopy, who's the director of our health department, and of course, Paola, who is doing our ASL translation, and Alice from the health department. And so I want to thank them, and we'll go ahead and begin the update. We're going to be doing today a review of the data again and how the city is doing, and also a review of kind of what's next for us in the days ahead here. I want to start by saying that as of today, we've had about 3,500 residents that have tested positive for COVID, and approximately 65 of them have recovered. So of course, people continue to recover. We've lost 123 Long Beach residents to COVID-19, which is very sad for all of us, and 93 of them have been associated with long-term care facilities. Let's begin by a little bit of what the governor mentioned today and what we have to look forward to. I think we're all aware now that just yesterday, the state of California has reached its highest levels of COVID cases. The governor, of course, mentioned that earlier today. It's something that should be alarming to us statewide, certainly here in the LA County region where the numbers are higher than other parts of the state, and it's certainly concerning to us here in the city of Long Beach. We also know that as you look across the country, many states in the country are seeing their infections rise, while you have other parts of the state are beginning to see those flatten or decrease in some cases. And so it's very concerning that the state of California continues to be very challenged with COVID-19. It's not to say that there isn't a really strong effort happening, but it's one that clearly needs to be refocused for all of us, and we continue to be committed to ending this virus in our community. Want to say generally, and I think this is important as we begin to review the data as well, that Long Beach has had the slowest and most cautious reopening schedule of any city or county in the Southern California region. So if you look at us versus the city of Los Angeles or the county or Orange County or even going down into San Diego and other places, Long Beach has had the most cautious reopening schedule. And it has in some cases been behind a week or two on other reopenings that have happened in other places. Yet, even with that cautiousness, there's still concern for me and for us here locally as we review the data. Let me also just as a reminder, remind folks that the state continues to not permit gatherings. We know that as the 4th of July nears, and families and other activities and events like block parties, which usually take place, begin to get closer to those dates. The state of California does not permit gatherings. It only permits gatherings with two exceptions. One is for religious types of events or church services, worship services, funerals, also those types of events. It provides some level of gatherings, and also for public protests. Why is that the case? It's because those two areas, there are also First Amendment considerations that the state has looked at in those two areas. And so yes, in the case of some types of protests, and yes, in the case of church services and worship services, those are permitted and allowed by the state of California. But the state does not allow any other types of gatherings or large gatherings, whether these are events in hotels, whether these are events on block parties, or whether these are large festivals or gatherings of folks. I understand that some folks want to get their permits from the city for these events. The city can't give permits. No, we're not allowed to, by the state of California, to give any permits for any gathering, even as it relates right now to the 4th of July. And so I know that's disappointing for a lot of folks. And I think what the state is focused on, as we are, is listening to the health and medical professionals and to continue and remain focused on public safety and protecting the most vulnerable. I want to now go over some of the health data that we have in front of us. Let me begin by going over the first image that we see. This first image is a slide that indicates the COVID-19 cases by episode date. As you can see, our current trajectory here is not going in the right direction. And in fact, we have seen an increase in our case count for the city. Now, while it isn't an enormous spike, it's still a concerning uptick that we have seen even just within a week or two from that case count. This increase can be attributed to a couple factors. Yes, we're testing more and our testing options increase, and we understand that. But the reality is that more people are also out in public, which is causing more instances of community spread. We provide COVID-19 testing for all now, whether you have symptoms or not, at our testing locations across the city. And we've conducted nearly 70,000 tests in Long Beach. And as we know, the city provides tests for free. We're not asking for insurance, whether you're documented or not. Please also know that there has been now additional wait time added to testing. Now that we're testing everyone, we're seeing a lot of businesses saying, hey, before folks can come back to work, we want all our employees tested, which is a smart thing to do. We're seeing large organizations send all of their folks to our testing sites. So to slow down testing, not just here in Long Beach, but across the county, and some of the press has reported on that. And we knew that would happen somewhat with testing, but we want to continue to expand and look at ways to improve that. Let's also talk about this second chart. This second chart shows you the cases per 100,000 population. The light blue line represents us, Long Beach. We know that we are doing better than the city of Los Angeles and the county from a population perspective, from cases, but certainly above the state of California. Our positivity rate has been increasing. And that means the portion of positives on all the people being tested has become higher. Now let's look at our deaths per 100,000. So just to go back a little bit, I think there was an audio issue. So I'm just going to review the deaths per 100,000. Is that okay, Kevin? Okay. So this slide here shows you that overall our deaths per 100,000 obviously are doing better than the county, but still lag the state. And what I mentioned earlier was that these are, of course, real people. It's hard to quantify someone's life on a chart like this. It's tragic that every single person died, but our fatality rate has remained consistent and is not flattening out in a sense where it's starting to go down. This next chart is our hospitalization chart. And our hospitalization chart continues, again, to not see any type of downward trend. Hospitalizations, about 46% of them are associated with long-term care facilities. And we've noticed that younger people now are getting hospitalized at a higher rate. And younger people are also asymptomatic. They don't have symptoms and they're passing it on. And so this shows that while there is not an enormous spike here in hospitalizations, it certainly isn't in any way going down. And you could argue that it is slowly increasing or ticking in the wrong direction up. And this is something we have to be very, very careful about because hospitalizations can go poorly very quick. And so again, hospitalizations, you see the rate there on the chart. Let me show you this next image, and this kind of gives you an idea of our hospital data. Our hospital bed usage right now is at 59%, close to 60%. That's remained fairly stable. It's gone up just a little bit. Our surge capacity remains in place. We have obviously plenty of room, but I want to share, and our ventilator use is still at about 30%. But I want to share something with you that concerns our health department. You can go from a hospitalization rate of 60 to 70 or 80 rather quickly, particularly if community spread is happening in a city. We're getting reports that there are states right now in the country that are reaching levels of 90 to 95%, in some hospitals 100% hospitalization occupancy. That is a huge critical danger and somewhere we do not want to be in California, and certainly not in the city. California, hospital occupancy and ICU occupancy is going up. And we heard that earlier today from the governor, and that should concern us here in Long Beach. Please remember that we don't live in a bubble. People move in and out of our city, whether they live in Orange County or in Long Beach or in LA or other parts of the area. So it's very, very concerning. Want to note that we do have plenty of PPE still in our inventory. We've been giving out a lot of PPE to our healthcare facilities and others, but there's always a need for more. Let me turn this over here to our health director, who's going to get into some more details, particularly on our positivity rate that is concerning to her, to me. And as a reminder, I think we have to remember that the COVID-19 health crisis is not over. And even with our city's a more cautious approach, we have to continue to be extra diligent and even more careful. So let me turn this over to Kelly Colliff, who will have more details on the data.
Thank you, Mayor. So when we first started all of this, we started paying attention to whether it was time to open, starting to reopen almost anything at a space that was a little bit faster than what the state was looking at. So this conversation about the attestation and the ability to move faster. At that time, there were a set of 6 different indicators. We looked at shelter capacity, stable hospitalizations, testing positivity rate, testing capacity, hotel surge, and skilled nursing facilities. At that time, when we began reopening, we met all of these criteria. At this time, however, we meet 5 of the 6. Jurisdictions meet the testing positivity rate indicator if the percentage is under 8%. The number is now 8.4%, and which is we're also seeing in LA County as well, as they went from the low 6s. We started at 6.3% to up over 8%. So we're seeing it more broadly throughout the county as well as in the city of Long Beach. The positivity is one indicator, but does not tell the entire story as what's going on for COVID-19 in Long Beach. The increase is very concerning to us, but it's not unexpected. People are out more. You know, the weather is beautiful. We've had a lot of people, a lot of things that are opening. The opportunity in various protests, we had over 60 protest opportunities in the past 3 weeks. So people are out. But as the mayor mentioned, is that we're really seeing an increase among those who are under the age of 30. So with all this started, those who are under the age of 30, maybe 15% of the entire population, if that were testing positive. Now it's almost a third. So almost a third of all of our positive cases are now among people who are under the age of 30, including seeing increases among those ages 0 through 9 and 10 through 19. So I think it's really important that we pay attention to that. But what we don't see is the cases from younger folks showing up in the hospitals. So I've talked about this before, is that really hospitalizations is the place that we really focus our attention. If we start to get to a point where our hospitals look like they start reach full capacity, or that we're not going to be able to meet through surge capacity, that is a time for which we will really need to think about closing things back down. I've been getting that question a lot. Our focus right now is really making sure that people out there are being as careful as they can be every day, that we are following the face covering rules, all the other pieces. So what we really know is that COVID-19 clearly is continuing, and we have to stay vigilant about all that we're doing. So now we look at the stability criteria. So the state has also set out, so they set up the criteria at first that said, okay, you can start reopening. Now they're really paying attention to some of the same criteria, some different, where we say, you know what, this is when you really need to start paying more attention. Those look at the tested population, stable hospitalizations as well. The previous to open was stable hospitalizations over 5 days. They're now looking at a 3-day average, and they want to make sure that it's no more than 10%. We are well below that number. The testing positivity rate, they still focus at the below 8%, so we're above that. The case rate, so less than 25 total cases per 100,000, that was really set up for rural environments who had very few cases. So it's been sort of a trade-off between what we have in urban jurisdictions, whether you look at that or whether you look at the testing positivity rate. So we focus primarily there, as our case rate is, over 100 per 100,000. Our ICU beds, we meet that, and the ventilators, we meet that as well. So we're still doing very well on the stability criteria. We just continue to focus on our positivity rate. So on Monday, because so many people out, there's such an interest. Businesses want to get back to work. There's just an incredible demand on our testing sites right now. At this point, all of our test sites are full for the next few days. And so we are working to see if we can expand that. But our health officer, Dr. Davis, talked about, that we're really seeing a lot of employers who believe it's important that we test people before they start. So when you are testing someone before they start, it means that 1 minute, they're negative. And so it could be that they're exposed the next day. It could be that if they tested again 3 days later, they would be positive. So we're really encouraging employees not to use that as a criteria for starting. It is not a practice that we rely on as for the safer at home order. It's not something that we support as public health. It is important for everyone to continue to maintain all of the different protocols. So, if someone has been in close contact with someone who has who's been COVID-19 and who has been tested, it is important for them to be tested, right? So if you've been exposed, we do encourage you to get tested. If you have symptoms, we encourage you to get tested. But it's just not necessary for an employee who does not have symptoms or has not been in contact with someone with COVID-19 to be tested otherwise. With more people living in their homes, we want to make sure that those who are at highest risk for COVID-19 or for developing severe illness to be prioritized for testing. And that's who is utilizing our appointments. And so we do encourage businesses to be vigilant about their employees wearing face coverings, maintaining your physical distancing, and staying home when they are sick. We want to make sure that they are also really making sure they're sanitizing throughout on a regular basis. So although many businesses reopen in most sectors, it's still advisable for employees to work from home when possible to reduce the risk of COVID-19. And I also want to remind everyone that our testing sites do require appointments. There are a lot of people who are saying, okay, well, there are no appointments available, I'm just going to walk up. And we've done everything we can to support people who are walking up. But we are going to have to start turning people away. The demand on the testing sites, we had over 500 tests given at one of our sites over the weekend. So we really do want to make sure that you are making appointments. We know they're filling up. We ask you to really save your request for appointments if you have been exposed or if you are showing symptoms. It's also really important to let us know if you've made an appointment and you're not going to keep it, because then that actually creates opportunity for somebody else to be tested. So we continue to do everything we can to get people in. And if you're not able to keep your appointment, we ask that you contact us through the public health info line at 562-INFO, otherwise known as 562-4636, so that we can give that slot to other people. Lastly, I just want to remind you that we are working within our reconciliation framework, and we are holding a whole set of town halls and listening sessions. There is a city reconciliation framework and listening session town hall, which is next Tuesday, June 30th at 5:30. It's an opportunity for you as community members to share your experiences, your feedback, your ideas about inequity and harm caused by racial injustice with your city leadership. You can find more information on Tuesday's session, as well as dates and times for additional sessions and transcripts from the town halls that have happened so far at Office of Equity website, which is longbeach.gov/Office of Equity. With that, I'll turn it back to the mayor. Thank you.
Okay, now, any questions?
Yes, Mayor. We have
Maybe if there's questions for me, and then we'll give it over to Kelly if there's questions for her.
Definitely. First question is for you from Haley at the Press Telegram. As the statewide hospitalization rate increases, Is there any update the city can provide on the reopening of community hospital?
So that's a good question. So I think that's obviously, we've been wanting community hospital to open now for many weeks, months it seems like here. That is something that the medical group is still working on. I understand that they're still going through the state process to reopen. They have staff in place. They are doing some work, but they are waiting for their final approval through the state licensing process. And so absolutely, we want them to reopen as soon as possible. They are set. I heard recently that there's a few days ago that they're still working towards reopening soon. But that would be really a decision the state's got to make about when they reopen. And so we're waiting on that final approval.
Thank you, Mayor. Next couple questions are for Kelly. The next question is from Crystal at the Long Beach Post. Kelly, are we seeing delays at the testing sites due to high testing demands? If so, what is the city doing to address this high demand?
We are seeing delays. So as I mentioned, the appointments are full at this time across our system. We are working to open additional capacity across the different places, as well as working to take some walk-ups along the way, though that is really an area that we're trying not to fill up. But we are looking for more permanent sites, as well as the ability to expand the lanes within those sites. The turnaround time for the test, though, remains at about 48 hours.
Okay. Our next question comes from Kelly at the Long Beach Post. Kelly, go ahead. Okay, I think...
Across our system, we are working to...
I think Kelly had a similar question to Crystal. So I think that question was answered. Okay. All right, now we have a question from social media for Kelly. Can an HOA choose to follow LA County protocol rather than Long Beach related to swimming pool use?
No, so anyone who lives, any business that is in the city of Long Beach is required to follow the Long Beach health order.
All right, thank you. That finishes questions.
Thank you.
Now we will have Spanish interpretation.
Muy buenas tardes. Gracias por acompañarnos hoy en nuestra sesión informativa del 25 de junio. Comenzamos con nuestros números. Desde hoy han habido 3,509 residentes que han dado positivo por el coronavirus. Aproximadamente 2,565 personas han recuperado. Hemos perdido a 123 residentes de la ciudad de Long Beach y 93 de esos residentes se han sido asociados con centros de enfermería de largo plazo. Queremos avisarles que la ciudad de Long Beach, en todo el estado de California, no se permiten reuniones grandes, eventos y reuniones en grupos grandes, especialmente cuando no viven en el mismo hogar. Con eso, al caso que el 4 de julio se aproxima, el próximo fin de semana, queremos recordarles que cualquier espectáculo de fuegos artificiales no es porque la ciudad no quiere dar permiso, sino es que el Estado no está permitiendo estos eventos. En la ciudad ha tomado su tiempo. Nosotros en Long Beach nos hemos tomado nuestro tiempo para reabrir negocios, para reabrir nuestra economía. Hemos tenido mucho cuidado, pero eso está fuera de nuestro control. Esto está controlado por el Estado de California. Solo se permite, por lo tanto, reuniones de estos tipos en grupos para servicios religiosos o por las protestas que han pasado en las últimas semanas. Vamos a empezar con algunos de nuestros datos sobre que le compartimos con ustedes. Saben que hace pocas semanas les dimos un reportaje al principio del mes y ahora queremos seguir dándole unos números importantes. La primera imagen que vieron cuando habló el alcalde fue que son los casos por fecha del episodio. Las imágenes indicaban los casos del coronavirus por fecha y esta semana vimos un aumento de 22% a nuestro recuento de casos para la ciudad actual que nos trae al 3.509. La semana pasada, este mismo día, teníamos nada más 2.888 casos. Este aumento puede atribuirse a dos factores principales. El primero es que hay más personas saliendo al público, más personas que están regresando a trabajar, eso causa que la propagación de la comunidad sea más grande. Y la ciudad continúa ampliando pruebas también para los residentes, lo que resulta en que entre más personas se hacen una prueba, más personas estamos teniendo resultados para más personas. Ofrecemos pruebas gratuitas del coronavirus para todas las personas que sean sintomáticas o no, y también en nuestras 3 nuevas ubicaciones. Hasta la fecha hemos realizado 70,000 pruebas del virus, y recuerden que no se necesita seguro médico para recibir una prueba del coronavirus en nuestros sitios alrededor de la ciudad, y también no les estamos preguntando su estatus inmigratorio. En la segunda imagen que vimos, continuamos viendo la tendencia de casos por cada 100,000 personas en comparación con la ciudad de Los Ángeles y en el condado de Los Ángeles. Eso significa que la parte de los positivos de todas las personas que se están evaluando se ha vuelto más alta. Y las muertes por cada 100,000 personas nos muestra la tercera imagen del coronavirus, que está debajo de la tasa del condado, pero de Los Ángeles, pero por encima del nivel estatal. Tenemos aumento en los casos en los últimos días. Nuestra tasa de mortalidad sigue siendo constante en la ciudad de Long Beach. Dicho esto, sentimos los impactos de cada muerte, levantamos la pérdida de los 123 que han muerto en nuestra ciudad, y nuestros pensamientos y oraciones están con todos ellos. Ahora, la cuarta imagen nos enseñó hospitalizaciones a lo largo del tiempo. Los hospitales nos informan al Departamento de Salud y a la ciudad diariamente. Actualmente, casi el 50% de nuestras hospitalizaciones están asociados con los residentes que viven en los centros de atención de enfermería a largo plazo y tienen periodos. Estas personas, pacientes, desafortunadamente son los que duran un poco más en el hospital, los tenemos monitoreando más largo y por muy cerca de todas las tendencias, por la vulnerabilidad de su salud y la edad. Los datos de hospitales aquí en nuestra ciudad, nuestra capacidad hospitalaria continúa siendo estable y adecuada. Tenemos un total de casi 1,500 camas de hospital en toda la ciudad y una capacidad de aumento de más de 441 camas. Nuestro uso y la cantidad de ventiladores continúa siendo saludables, y como pueden ver en la quinta imagen, nuestras camas de hospital tienen una capacidad del 59% y el 29% de nuestros ventiladores están en uso. También, a medida que continuamos reabriendo más nuestra economía y permitiendo más actividades, les haremos en función de los datos y el asesoramiento de nuestros expertos de salud. Nuestra directora, Kelly Colopy, también nos brindó más datos sobre el coronavirus y otros siguientes indicadores que vamos a platicar en estos momentos. La imagen número 6 enseña los criterios actuales de preparación del Estado, y esos son capacidad de refugio, hospitalizaciones estables, prueba de tasa de positividad y capacidad de prueba, y una oleada hospitalaria. Instalaciones de enfermería especializada también. En estos momentos estamos cumpliendo 5 de esos 6 criterios. Las jurisdicciones pueden cumplir con el indicador de tasa de positividad de prueba si el porcentaje es el inferior de 8%. Actualmente, nuestra tasa de positividad de pruebas es el 8.4%. La positividad es un indicador, pero no cuenta toda la historia de lo que está sucediendo con el coronavirus en nuestra ciudad. Este aumento es preocupante, no es inesperado, dado que ha hecho que estamos evaluando a más personas y las personas están fuera y más de lo que estaban hace unas semanas a medida que se está reabriendo más negocios. Este aumento nos recuerda que el coronavirus claramente continúa propagándose en nuestra comunidad y debemos estar atentos a las precauciones que tomamos con nuestras vidas cada día. Hemos visto un aumento similar en todo el estado y también en todo el condado. La última imagen, la imagen número 7 que vimos, es más los criterios de estabilidad. Es cuánto los criterios de estabilidad estamos cumpliendo todos los indicadores menos 2. Velocidad de casos, este número generalmente se enfoca en áreas rurales y no ha sido un foco para nuestra ciudad que nosotros consideramos una ciudad urbana. Como mencionamos anteriormente, nuestra tasa de positividad a este momento es 8.4. Terminamos con unos datos, información sobre nuestras pruebas y los sitios de pruebas. Desde el lunes, la doctora Davis habló sobre algunos de estos que estamos viendo nosotros en nuestros sitios de prueba, que algunos de los empleadores están pidiéndole a los empleados que tomen unas pruebas de coronavirus antes de regresar al trabajo. Queremos reiterar que esta práctica no se indica en la orden de salud o más seguro en su hogar de nuestra ciudad. Es importante que las personas que han estado en contacto cercano con alguien que tiene el coronavirus se haga la prueba. Si ha sido expuesto, sabe de alguien y usted estuvo cerca de alguien que ha sido positivo con el virus, entonces es la manera que debe decir, ok, tengo que hacer una cita para hacerme una prueba. Es importante recordar que si alguien le ha dado un resultado negativo algún día, no significa que no haya estado expuesto o que no sea positivo, por decir, unos días después o la próxima semana. Con más personas que abandonan sus hogares, queremos asegurarnos de que las personas con mayor riesgo de contraer el virus o desarrollar enfermedades graves tengan prioridad para las pruebas y que puedan hacer citas. Lo que sí alimentamos a las empresas a hacer es que estén atentos a que sus empleados usen sus coberturas faciales, que mantengan el distanciamiento físico y que se queden en casa cuando estén enfermos. También queremos recordarles a todos que nuestros sitios de pruebas requieren citas. En estos últimos días hemos visto un aumento de personas que están tratando de llegar a los sitios de pruebas sin hacer una cita previamente. Y queremos recordarlos, estamos tratando lo mejor de tomarlos a todos, pero no es posible aceptar a todos los que llegan sin una cita. Hemos tenido algunas personas que llegan y desafortunadamente son rechazados. Tenemos que poner un límite porque tenemos que seguir los horarios de los sitios que tenemos por el personal que está trabajando y los voluntarios que tenemos en esos sitios día a día. Es importante también que si hace una cita y por alguna razón no puede llegar ese día, que también llame o que deje saber que tiene que cancelar, así le podemos reservar esa cita a otra persona que lo necesite. Ha habido una mayor demanda de pruebas en todo el condado durante esta última semana, que ha sido dificultoso que las personas que están a más riesgo tengan oportunidad de hacer la cita. Si no puede asistir, como le dijimos, puede llamar a la línea de información de salud pública, que es el 562-570-4636, para que podamos poner a disposición a otra persona. También algunos de los últimos detalles sobre los recordatorios de reconciliación. Queremos recordarles a todos que sobre el marco de reconciliación de la ciudad y las sesiones que hemos estado teniendo y vamos a seguir teniendo por la semana. La próxima sesión en la alcaldía será el próximo martes 30 de junio a las 5:30 de la noche. Esta es una oportunidad para que como miembros de la comunidad compartan sus experiencias, sus comentarios y sus ideas sobre la inequidad y el daño causado por la injusticia racial con los líderes de la ciudad. Puede encontrar más información sobre la sesión el martes, así como las fechas y horas para las sesiones adicionales y transcripciones de las que ya han pasado. Gracias, muchas tardes. Gracias por acompañarnos hoy. Es toda la información que tenemos. That is everything we have for today. Thank you for joining us. We will be back next week with the latest updates. Thank you.